At 4:30, a panel of experts is recommending a major change in guidance for how millions of Americans use aspirin. They're calling on doctors to stop routinely prescribing aspirin for daily use.
Based on the latest evidence, we now recommend that people 60 years and older should not start to take aspirin because the harms cancel out the benefits.
And the panel says those harms could include internal bleeding, which can be fatal. They estimate 29 million people who do not have heart disease are taking aspirin every day for prevention. And of those, almost 7 million people do so without a medical recommendation. Joining me to talk more about this is Dr. ASEEM, Associate Chief of Cardiology at St. Francis Hospital. Doctor, thank you so much for being with us.
Thank you for having me.
So I think a lot of us were surprised yesterday when this news came out, the panel saying that the cons really outweigh the pros of taking low-dose aspirin every day, which so many adults have been doing for quite some time. Can you tell me exactly what those big risks are?
Sure. So aspirin's been a great drug and has been around for several generations. It's vital to prevent heart attacks. And when we talk about pros and cons, we're really talking about the risk-benefit equation in these patients. And there have been several papers and guidelines recently that have confirmed that the overall benefit of aspirin in primary prevention has kind of diminished over the years, while the bleeding risk continues to be high, especially if you're the age of 60 or 70 years of age. And if you look at some of the papers, this is almost 30 to 40% increase in the risk of bleeding. And when we talk about bleeding, it's not minor bleeding alone. It's, as you pointed out, it could be bleeding in the gastrointestinal tract, or what we call as GI bleeding, or bleeding in the brain causing hemorrhagic strokes, bleeding requiring hospitalization or blood transfusions. And sadly, as again you pointed out, catastrophic fatal bleeding. So while it's an over-the-counter drug, the side effect risk profile is anything but benign.
This really changes the guidance that we have been getting for years. In fact, when I learned this yesterday, I immediately texted my parents to let them know. I imagine other people did the same. So I think that begs the question, is it okay for folks to stop taking aspirin cold turkey if they've been taking it for a number of years, or do they need to consider things and maybe taper off before they stop completely?
I think that's a great question, and I think it's important to recognize that this panel recommendations were really for primary prevention and not secondary prevention. So if you've had a heart attack, if you've had a stent, if you had a bypass surgery, and your physician's asked you to be on aspirin, then please talk to your physicians, and you should not be stopping aspirin in those scenarios. I think when we talk about primary prevention, that is patients who are at risk for heart disease but have not had a heart attack as yet, and you want to mitigate that risk. What this panel recommends is having a shared decision-making conversation. It should be an impetus to have that conversation with your physicians, whether you should start aspirin. But I would not recommend anyone stopping aspirin without talking to their physician or their clinicians, their primary care physicians or their cardiologists or the neurologists.
All right, a lot of great information, and we certainly appreciate your expertise. Dr. ASEEM, thank you so much for being with us this afternoon.
Thank you.